Good morning. It is surgery day, and it's about 9:48. I have to be at the hospital at 10:30 for my surgery at 12:30. So I just have on a little, I'm in my kitchen, y'all. Excuse the kitchen. I just have on a little pajama set. It's really nice and soft. I got it from Sam's Club. It's more like a lounge set. I anticipate staying overnight. That's what I was told. So I packed a little bag just with not much, just a small amount of toiletries. I have my ID, insurance card, my phone card, chargers, some lozenges for my throat, some of my hydration drinks, and a bone broth stick. And that's pretty much that's what's in the bag. Everything else, as far as like what I'm going to sleep in and comfy socks and robe and stuff like that, I'm going to use what the hospital has. I'm not taking my stuff there. And so my husband is upstairs getting ready. He's going to drive me. He'll be with me the whole time. Last night, I took the shower with the Hibiclens, the antibacterial soap. And to be truthfully honest, I wasn't all that dry last night, to be just really honest. I didn't feel real dry. I did put something on my lips last night. So today I got up, did the whole ritual again. So they tell you need a fresh washcloth, a fresh towel, fresh undies, just fresh everything when you do your second shower the morning of. And so I did that this morning, and I do feel kind of tight on my skin. But it's not too bad. I'm not feeling like I'm getting ready to just like crack open, but I don't like my lips being dry. So that is kind of bothering me. But as far as my skin is concerned, not too bad. So I wouldn't worry about that too much. So yeah, we're going to be heading to the hospital here shortly. So hopefully I can do some footage there. If not, my nerves are good. Like, I feel good. I've had tons of prayers from my friends and family coming forth this morning, starting at 5 o'clock this morning, through the night. My mother-in-law called and prayed over me. Even my 14-year-old, he prayed over me before he left for school. And I just feel really good. So I'm not worried about anything. They said I could have Gatorade or clear liquids prior to arriving at the hospital. So I have had some Gatorade this morning and a little sip of apple juice. And I will drink a little bit more Gatorade until we get there. So I hear it's really good to carb load before surgery so that you're not so depleted after surgery. But other than that, I haven't had anything to eat or drink since about 9:30 yesterday evening. And the last bit of food I did have was a fruita bowl, and it was just like a smoothie bowl with fruit and granola and peanut butter. So did have a little bit of protein with the peanut butter. So, but yeah, that's it. So you guys, hopefully, like I said, I can grab a little bit of footage of us going into the hospital, what my room looks like, and yeah, before I go into surgery. If not, you'll see me after surgery. All right, be well. So a surgery resident just came in and said she was going to scrub in on my surgery, and I told her no. 10 years ago or more, I had an ablation, and the resident that was attending my physician punctured my uterus, and I had a failed ablation. I don't think I want to be practiced on twice. So I said no, and I'm okay with that. So on my consent form, it says that I'll have a hysterectomy with a bilateral salpingo, I think is what it's called, but not an oophorectomy, which is taking my ovaries out. And so I'm not signing it until I talk to the doctor. I want my ovaries out, so I want to have that conversation with him first before I sign my consent paperwork. Good morning. Well, yeah, it's still morning. I don't know if you would consider this day 1 or day 2, but this is the day right after my surgery. Let me put something on my lips. Okay, so this is the first day after surgery. I'm feeling pretty good. I am feeling a little bit of the gas in my chest and kind of in my upper belly. And last night I felt a little bit too, but it's not unbearable. My pain has not been terribly bad at all. I only took, let me see, I got home from the hospital maybe about 6 or 7 in the evening. And I took at 10:30, I took ibuprofen, 400 milligrams of Advil. And then at 4:30 in the morning, I took 500 milligrams of acetaminophen. And then this morning when I got up, right before I ate my breakfast, I, had a little snack and took 400 milligrams of Advil again. So I've been alternating Advil and Tylenol about every 5 to 6 hours. So I haven't had to take any of the big guns, any of the big medications that they sent me home with. I was sent home with, I hope you all can hear me. I was sent home with 800 milligrams of ibuprofen. Let me see if you can hear me. Okay, I thought my finger was over the microphone, under my phone. Anyway, I was sent home with 800 milligrams of ibuprofen, 5 milligrams of oxycodone. I was sent home with Zofran, which I took one of those last night because the nausea and vomiting. And they also sent me home with muscle relaxers. So I don't, that was the first time I heard being sent home with muscle relaxers from out of all the videos that I've watched. Being sent home with a muscle relaxer was, I don't know, that was kind of different. But I haven't had to take any. I'm not quite sure what they're for either. I remember her talking about them in my release notes in my discharge, conversation with my husband. I was so out of it. I don't remember what she said take the muscle relaxers for. So anyway, I haven't taken any of the medicine from the hospital or any of the prescriptions as of yet. So, so I'll take you back a little bit. Yesterday, I think the last video I was talking about how the resident came in and wanted to assist Dr. Harris with the surgery. And I was like, no. 10 years ago or so, I had an ablation, and the resident at the time was sounding my uterus and actually punctured my uterus. And so my ablation was a failed ablation. And so I told her, no, I didn't want to be a guinea pig twice. I have contributed to the medical society with training their doctors. Once is enough. I don't need to go through that again. And she understood. She was very nice about it. And she said, truthfully honest, if it was me, I wouldn't want to do it either. So that was a no. And so, the anesthesiologist came in. They gave me a little something in my IV, which kind of made me, a little sleepy. And after that, I don't remember anything. All I remember was waking up at about 4:30 p.m. They came and got me maybe about noon, 12:30 or so, 12:20 or so. And then I remember waking up at 4:30 p.m. and her telling me that everything went well and she was going to go get my husband. And she went and got him. He needed to go and pick up my son and get him ready for his dance. So he left me there. And he came back and got me at about 7, was it 6:30? Maybe it was 6:30. He came and got me at 6:30 that evening. I think I rolled out at like 6:30 that evening. So my recovery time was just those 2 hours. I thought I was going to have to stay in the hospital overnight. That's what I had been told from day one, that I was going to be in for 24-hour observation. When Dr. Harris came in and spoke with me, he said, I'm going to try to send you home today. So I was fine with that. I said, as long as I feel fine, send me home. And they did. So at about 6:30, 6:45, she was giving us our discharge papers. Now, from the time that I woke up, they were forcing me to eat and drink, eat these crackers, drink this water, eat these crackers, drink this water. You want some, 7-Up, Sprite, what do you want? And so I was drinking sips of water, a little bit of cracker. She asked me about my pain, and I told her it was about a 4, no big deal. And then a little later on, she asked me about my pain again, and I said, oh, it's about a 6. She was like, oh, let me get you some pain medicine. And I said, okay, but I was so out of it. I mean, I couldn't keep my eyes open. She would ask me something and I would say yes, and I'd close my eyes and I just could not keep my eyes open. And I remember holding on to this cracker, and it was a Keebler Club cracker. And I ate 1/4 of it, and she shoved this pill down my throat. And, I had no wherewithal to refuse it. And a little sip of water. And before you know it, within 30 minutes of that, I was vomiting. So my husband had already left, and I felt like I had the hiccups, like, how you kind of hiccup. And then all of a sudden, before you knew it, I knew it was coming back up. And it just did. It just came back up out of nowhere. It was terrible. And so she was able to get me one of the little bags really quickly. And after I threw up, I felt better. And she said, well, let's get you up and see if you can pee. And I was like, yeah, I can pee, because I could feel it. I could feel the pressure of needing to pee. And I think that's really what it was. And so she wheeled me to the bathroom on the bed. That's how groggy I was. She was afraid to get me up and walk because she didn't think I could make it because I was so groggy. Got on the toilet, used the bathroom, and I know I'm being real graphic, but it just is what it is. You're here to hear the real, right? Use the restroom, and I couldn't even wipe myself. She wiped me. There was some blood, and she was saying, it shouldn't be more blood than this. And she showed me the tissue. She said, if there's more blood than this, then you need to let us know, but it should start to dissipate as time goes on, and it has. Today, there's hardly anything. It's just a little pink, not hardly any blood at all. When she wiped last night, yesterday evening, it was a significant amount. Not to the point where it was clotting, but it was very evident that I was still bleeding. Got back in the bed, laid back down, and I started to shiver uncontrollably. And I do not know what that was about. She was like, it's really common with anesthesia and narcotics. She was like, let me get you in your clothes. You'll feel much better. She eventually got me in my clothes, my socks and my shoes and everything. And I did start to calm down from the shivering, but it was almost like convulsions. Like my teeth were chattering. I just was and it wasn't that I was cold. I just couldn't stop shivering. And I didn't feel cold. I just couldn't stop shivering. So I finally calmed down from the shivering. Felt like I was going to be sick again, but did not get sick. And my husband came, and she's talking to me, like staring at me with these, telling me, about the discharge papers and what the discharge papers say, talking to me. And my husband is standing there, and I'm looking at her saying, okay, but every 5 seconds, I'm doing like this. Like I'm going out, and I'm like, oh, okay. I could not pay attention. So finally get rolled out. And I think the movement from being rolled out and riding in the car, as soon as I got home, I was vomiting again. And so that was kind of the one thing. And I wondered if I kind of brought that on myself by just being so worried about vomiting that I did end up getting sick. But, after I got sick, when I got home, I felt so much better. My husband got me in my nightgown. My mother-in-law was here. She made me some bone broth. I was able to eat a few little Cheez-Its. I lay back down. My son came home. I remember hugging him. I remember my mom coming in to check on me. I hugged her, and I was out. And I didn't wake back up until 10:30 p.m. It was 10:37, and my husband was coming back upstairs to kind of get in the bed, and I set up and ate crackers and more bone broth because he warmed it up for me, and so I could take, some ibuprofen at that time. So that was pretty much my evening yesterday, and my time at the hospital. The nurses and everything were really good. Everybody was really nice. My doctor was in good spirits. He was on point like he always is. The only kerfuffle I had yesterday, I think when the nurse was trying to do my IV, she was doing it in my hand, and she missed the mark on my left hand, so she ended up having to do it on my right hand. She started my IV, and of course my hand started to puff up, and she realized, it's not in the right place. So she switched it to the right hand. My right hand had my veins are very prominent on my right hand. And I think it's because I use it a lot. So you can kind of see where the IV went in. That was the only kerfluffle, and it wasn't a big one. She recognized she missed the mark very quickly. She changed it over. I talked to her a little bit and asked her how long has she been in the nursing field, and she said she had only been a nurse for 3 years. And get this, she said, and I'm still surprised that I'm a nurse. I'm like, what? But all was well. She was an older lady. I told her congratulations, and I was proud of her because a lot of times, and when I mean older, she was probably in her late 50s. And a lot of times, we don't pursue what we want to do when we get older. We kind of just lay our dreams to the side. And so I told her I was happy for her and proud of her that she continued on and became a nurse even after all those years. I don't know what she did prior, but just knowing that she pursued a different career later on in life was really good. So, but yeah, other than that, no other issues. I do feel like the hospital could be cleaner. That surgery section, I was just kind of looking around and just like the scuff marks on the wall and just like the crud around the toilet. And I'm thinking to myself, y'all need to overhauling. They need to like close down the area and just do a real deep clean. Cause I just didn't feel like the hospital was clean, in the surgical area part. Yeah. I've been in other areas of Miami Valley Hospital and have felt like, it was clean, but that surgical part, it wasn't. It didn't feel clean at all. Anyway, last night it was pretty uneventful. I woke up at, like I said, 10:30, took medication, 4:30 took medication, and then back up again at 8:45, 9 o'clock and took medication, just alternating 500 milligrams of Tylenol and 400 milligrams of Advil for pain. I do feel the fullness at the top of my stomach and have had some shoulder pain from the gas. So I've been up, walking around the bedroom, walking up and down the hallway. I was able to just make it straight upstairs yesterday after surgery. And I kind of took my time just getting up the steps, but I didn't have any problem, navigating the stairs or anything. My doctor told me that I would be able to utilize the steps with no problem. He said, just no driving for the first 7 days, but that I could, navigate the steps. It shouldn't be any problem. And I haven't had any. Having all of my goodies bedside have been really helpful. My Cheez-Its, I ate most of those last night. I ate a packet of peanut butter crackers. Like I said, my mother-in-law bought me hot water so I can make bone broth, and that was really nice just to have everything right there by my side and not have to keep, having to go up and down the steps, or my husband to keep, going up and down the steps and retrieving me items, which has been really good. So having all of those items right there has been really nice. So yesterday when I got home, there was a box on the porch, and I was asking my husband, what else did I order that I haven't opened yet? Because I thought I had opened up all the things that I gotten from Amazon. And I got the nicest gift from his cousin. She brought me a really nice gift. I'll see if can I turn this around? I don't think I can. I'll stop it and turn it around. She brought me the nicest gift, and it's called a gift seal. Tear it up. That's so cute. And it came in this cute little bag, little gift bag from Amazon. And it says, "Feel better soon, love you," from Victoria Lewis Scott. And that's my husband's cousin. Well, she's my cousin too. And it's this beautiful gift box. And it says, "Just for you, gift." And it's so nice. And so I have a lavender sprig in there. And it's a monogram cup for my first name, Anika. And so there's a little lavender candle, and it smells really good. Let's see if I can get it back open. I'm tearing the box now. I'm only working with one hand, and it's a nice little candle, and it smells it just smells really, really good. It smells like lavender. Real good candle. And I have some bath salts, just some like a little self-care box. Really cute. Bath bomb, and I love a good bath bomb, but bath bomb and a glycerin. Looks like a glycerin soap. It's called Diamond Soap. And I'm assuming that it's because of the shape of it, but it looks like a glycerin soap. It says Diamond Soap. Pure manual, pure mineral. Okay, so yeah, and that's what's in there. And then my cup has a little straw to it, and the little cleaning mechanism for the straw, which is really nice. So I thought that was such a blessing to come home to a beautiful gift. Like I said, I thought it was something else that I had purchased from Amazon, and no, it was a gift from our cousin Victoria. So I am real appreciative of that. That made me feel real good this morning, to see someone that was so thoughtful to get me something to make me feel better. Day 1, home from surgery. Today, I am going to try to get as much walking in as I possibly can, at least a good walk every hour and a half to 2 hours. I am going to nap when I feel like napping. I've had my first official meal, which was oatmeal with raisins and apples and cranberries, and it was really good. So I feel like I am going to shower a little bit later, but I think I'm going to go ahead and take another little nap. It is 10:30 a.m. right now, so I think I'm going to lay down, take a little nap. I did give a text to some of my friends and family who are concerned and who send well wishes, just to let them know I'm feeling great and all is well. So I will talk to you guys later on. All right, bye.